Hello, sir. I would like to start with a question. What is the most promising technological or clinical innovation in oncology recently adopted in India and how it can improve access or outcomes for patients in under-resourced regions?
Uh, so there are quite a few, recent advances which have happened, and a lot of them, because I'm a medical oncologist, for me, a lot of them revolve around the drugs. So there are a spate of new drugs which have come in, which can help improve the survival. Uh, there is also, in the field of preventive oncology, the use of AI in terms of mammogram screening, which can help detect the early cancers and breast cancers. So, in terms of surgery, there are quite a few of minimal access surgeries which can happen. So, I think in every field, there are quite a few. How they can improve the access, that I think it's something which बहुत ऊपर जा रहा है यार ये तो मुझे दे दे छोड़ दे इट्स ओके कैन यू शो मी द क्वेश्चन आई थिंक इट विल बी इजियर फॉर मी टू आप दोबारा कर दो
दोबारा रोल कर ले सकते हैं हाँ तो इट्स वेरी सिंपल जस्ट ये वाला हाँ थोड़ा
एक ही
ऊपर
पूछना है ना
सी एक और है वो फॉलो अप होएगा
नहीं
इसके
नहीं तो इसका ये पूछ ले आई थिंक जस्ट आस्क दिस
सेकंड वन
मल्टीडिसिप्लिनरी
मल्टी डिसिप्लिनरी ओके श्योर स्टार्टिंग से आपको मैं क्वेश्चन पूछ के बाद दे दूंगा आप उसमें कर दीजिए Good morning. Wait. Morning. Uh, Good evening. So my first question is, why is multidisciplinary collaboration between clinics, psycho-oncologists, nutritionists, and support services essential for improving the cancer journey in India? Where do you see the biggest gaps or opportunities?
So see, what you need to understand is oncology is a team sport. It's something which absolutely requires a teamwork and every clinical decision making. So it's rather important that for treating a cancer patient, you have every part being covered by a different specialist. So for treating a cancer patient, you require a surgical oncologist who does the surgery. You require a medical oncologist who does therapies, and then you require radiation oncology who does the radiation. And these are the these are one of the three branches which are there. But that doesn't end there. There's a lot more emotional trauma. There's a lot more emotional well-being which needs to be looked after. Hence, you require a psycho-oncologist who can have a deeper conversation, understands the anxiety, not only of the treatment but also of the recurrence. There's so many other parameters or perspective which need to be looked at. Palliative care is another. I think it's a huge support for the oncology. You require to look after the palliation. Every patient, every cancer patient requires some degree of pain control, some degree of symptom control, which is what palliative care takes on. Also, what you also require is almost one fourth, 20-25% of the cancer patients are advanced stage. Their conversation, their nutrition, their emotional well-being, their anxious well-being, everything needs to be looked after. So I think all of this has a important role to play in the entire cancer management. I think the gaps in the treatment, gaps in this team are obviously related to the availability of these resources at every hospital. Only the biggest and the apex of the centers are able to have so many different human beings playing their part. In periphery, it's difficult to get so many people working together in a team. So, and even if they are, it's difficult to justify them being there. Conversations have to evolve at a very team level for a comprehensive, wholesome cancer care to be delivered. Thank you.
So, a small follow up, sir. Uh, Talking about all the problems and all the things which are necessary in order to make this into a newer generation of cancer treatment, how do you think, what are the basic structural necessities which would need to make cancer treatment much more advanced in our country?
I think I would rather use the word equitable and accessible rather than advanced. I think we are fairly okay as well as the advancements are happening. There are, there are advancements happening in every field, and so are they happening in the field of oncology. I think what is rather important is how do you make the entire cancer care available to everybody who suffers from cancer, and I think that's a real problem to solve. How do you go to the grassroots level and to make that possible? How do you hub and spoke the entire cancer care. It requires obviously a regulatory overhaul, and it requires a effort by people like such as us and the bigger corporates to partner together to develop a cancer care which is more homogeneous, which is more wholesome, which is more distributed, which is more empathetic. So I think I would say rather than the outward look, I think there's a lot more need to look inwards and to understand those gaps and fill those gaps. Thank you.
Thank you so much.